I'm Dr. Vinita Reddy, Consultant Radiation Oncologist at American Oncology Institute, Hyderabad. Cervical cancer is one of the common cancers among women, and it is one of the common cancers leading to cancer mortality in India. So let us know about cervical cancer. Cervical cancer most commonly develops around the 40 years and above, but it is common in all age groups. So we have different age groups having doubts about cervical cancer. So let us take this and clarify them.
Hi ma'am, myself Charishma Tejasri. My age is 18. Do I have the chance of getting cervical cancer at this age?
So cervical cancer most commonly is a cancer of older age group like 40, 45 and above. But definitely it can happen before the age of 30. It is of course not so common, but definitely we have seen patients earlier than 30 coming with cervical cancer.
Namaste ma'am, myself Geeta, my age is 35. My question is, as I have 3 kids, does my chance to develop a cancer in my cervix increases?
So one of the most common reasons for developing cervical cancer is increase in parity or having more number of children, that we call as increased parity. So definitely that's a risk factor, but it is not that you will develop cervical cancer. You have a increased risk. So getting tested for cervical cancer, regular screening tests once in 1 or 2 years and doing a HPV test regularly might help to detect any precancerous lesions or and that might prevent cervical cancer. But it is not that definitely you will develop, there is no rule like that.
Namaste ma'am. My name is Rekha. My age is 55. My question is, ma'am, I was detected cervical cancer at the age of 35. After treatment, it got cured. Do I still have any chance of developing the cervical cancer?
Once treated with cervical cancer, so you are cured now. Once you complete 5 years, we take it as a cure. But nevertheless, there is definitely chance of cervical cancer coming back again. That's we call as recurrence. It's not that 100% you will get back the disease, but definitely there are chances that you might get that disease. That is the reason we ask every patient to come for regular follow-ups at least once in a year. And the recurrence might happen like even in the local area, that we call it as local site recurrence, primary recurrence, or it might the disease might appear anywhere else in the body like bones, liver, lungs or brain, that we call it as metastasis. So anything might happen, but because it's more than 10 years, the chances that the disease might come back are less. So we now had women from different ages with doubts about cervical cancer. Like one was young with 18 years of age, one had multiple sexual relations in the past, one was treated and cured for cervical cancer. So definitely cervical cancer is a disease of all ages, though it's more common in elderly age. There are some risk factors for cervical cancer like multiple sexual partners and more number of children, and having pelvic infections. So get screened for cervical cancer and to go routine regular screening tests like Pap tests and HPV tests are a must to detect cervical cancer early. And the Pap test is a simple and cost-effective test. It doesn't take much time and it's very safe and cheap also. Vaccination for HPV is a must. So it is routinely advocated for both boys and girls of adolescent age groups. Thank you.